welcome to another episode of Total Wellbeing. My name is Jacinta, and I'm here with Dr. Nwama. Today, we're talking about suicide. Yes, suicide. We hear about suicide all the time. We even know people who have suffered or who have, experienced it. But today, we want to know what causes suicide, how prevalent it is in Ghana and Africa. People think like, oh, in Africa, we're already suffering our suffering. We don't even need to commit suicide. But you'll be surprised the statistics we have. So, Doc, it's good to see you again. You're welcome.
Thank you. Happy to be here.
Great, great. And so, if you're interested and you can't wait to learn more, do stay tuned and we'll be right back. So we delve right into it. Doctor, tell us, what is suicide?
Suicide. I think any mental health professional, when this kind of word is mentioned, it kind of brings a lot to mind. But then just to break it down very simply, it is when someone dies by their own efforts with the intent of ending their life. So the person intentionally takes certain steps leading to them ultimately losing their life. That is what suicide is. So that would be contrast to when someone might die by accident. So for example, it might be the same, similar, looking like a similar scenario. Someone might be at a height and then accidentally fall. So that would be an accident. That's not necessarily suicide. But then when someone decides that I want to end my life and jumps, then that is more of a suicide.
Okay, Doc, as you were talking, I just thought about mercy killing. So somebody's suffering from, let's say, a terminal disease that's really painful, and they want to die. Maybe the doctors don't want them to, and then they overdose. That's suicide as well.
That is suicide. So with that scenario, as you mentioned, there are different aspects that could go into play. But when the person themselves takes some medications and an overdose and end their life, then that is suicide. However, if let's say a clinician comes in place or some other person comes in professionally to help them, then that's more of euthanasia and other kind of line we are looking at, yes. But then once someone takes the steps to end their own lives, then that is suicide in simple terms.
And how prevalent is this issue in Ghana?
So in Ghana, well, our statistics are not as ideal as we would want them, and there are a lot of factors that go into it. Generally, it is a criminal offense, so no one is going to kind of report that I have this thought, I tried it and it failed and all of that. So the statistics we have is a bit on the low side. However, in 2015, the data we have showed that around 1,500 people died by suicide. That's from our statistics. And even from some cardiac studies that have been done, it explains that for every death by suicide, we should know that there have been 4 other, that is reported. So for every reported one, we should know that there are about 4 other ones that might have gone on that are unreported. So then if you extrapolate that, you realize that it's way more than the numbers we are looking at. So it is a concern. And looking at the media space, the few that get attention for a period, you realize that it seems to be kind of rampant because we keep getting more attention. But then we should understand that that's just the tip of the iceberg. A lot goes on that do not get reported, that don't get the limelight or attention that people talk about, but it's really going on day to day in our environment. And for us, we understand that even for each person that would die by suicide, there'll be quite much many more who would have attempted, but not necessarily succeed is not the word, but they had not died from it. So, and from the statistics looking at WHO among others, they'll say for each person that would have died by suicide, at least 20 others would have had some attempts as well. So the numbers are really, really staggering, and it's actually real. That is the thing.
That's scary. I mean, if for each person who attempted, there are 4 others. I mean, and I want to know, is it seasonal? Because sometimes you realize that suddenly in the news, the suicide, and then at a point, it doesn't also happen. Is there a reason for that?
Yes, so actually there are a lot of factors that come into play as well, as I mentioned. For example, asking if it's a seasonal per se, media reportage of such things has a very huge role it plays. And sometimes when it's brought to the notice, how it is communicated at some point in time may make other people kind of try to mimic and do the same. So someone might be on the verge of quickly, where people might actually jump onto the bandwagon as it may seem. So during that period, it looks like you might have a bit more going on. So media reportage, we know, has a role to play in it, and media is supposed to be very responsible about how they report on cases or issues of suicide, because there might be copycat. Sometimes I realize that the trends kind of are similar, or it looks like it's having a similar trend. So that can be one factor. Then again, it may be that at that particular point in time, once one came up, now all of a sudden everybody is a bit more aware of it, so people now talk a bit more openly about it. But that doesn't necessarily mean that it goes away 100%. It's something that it's been there, and the statistics have been there consistently across regions. It's there. No region is like safe, or a place where we say that that doesn't have suicide going on. It goes on all regions as well.
Wow, so it means the media has a role to play in how they even report.
huge
Because I mean, if you are
responsibility.
very graphic about the details, somebody's literally waiting to hear how to go about it.
Exactly. And the focus should be more on, how to seek help, intervention that could be at play. But sometimes we kind of not necessarily glorify, but sometimes the
Focus
aim is
more on the
exactly trying
how
to, because you're
exactly,
trying to get so many people to follow in.
sympathize.
So the manner in which it is reported, it does need some technique, it does need some thoughts to it, beyond just reporting the news, but then the subsequent ripple effects. What would it be?
You said something in the beginning. You said suicide is a criminal offense. If I choose to kill myself, what has the police got to do with it? Why is it criminal?
Well, this stems from, it dates back from legislation that we have from 1960, so some Criminal Offences Act 1960, and that's where it says that aside from, so just even the whole thought and planning of trying to engage in such a thing, it's criminal, and well, not, I think it's more of I'm trying to recall the exact word, but when it comes to mind, I'll state it. However, I think it stemmed from the understanding that life is precious, and life is not necessarily just yours, because your life does have an impact with family, with society, amongst others. So it's essentially supposed to be for the country, and so you're not at liberty just to be taking your life. Or someone will say, I also want to take your life. What's the big deal, So that's where I think it stemmed from. However, times have changed, and this law is beginning to have a lot of impeding effects. As I mentioned, right now it kind of keeps people from even trying to seek or reach out for help, because it means I have.
Yeah, I can be jailed.
Yes, exactly. And so why would I say it? I remember recently a colleague was sharing a case where she had seen someone obviously attempted, because you could see the whole ligature marks all of it. But he kept insisting that no, I didn't, no, I didn't. And
I'm wondering
everything
why.
pointed, because your mom came and met you essentially just about doing it. And subsequently he said, look, I know it is against the law, and I have this fear, so I can't say such a thing. So he had to be reassured that no, this is a safe space. The aim is to talk and help you, not necessarily to just get you facing the legal consequences. And then that brought some. So it does have some hampering effect. Sorry. This was from things we inherited, like colonial, Commonwealth. So there are some legislature that we kind of looked at other countries and adapted and
Yeah.
used, but then most of them have done away with it. And that's how come mental health authority is actively asking and seeking and pushing that it gets decriminalized, because it's not doing much good now.
Between men and women, which gender is more prone to suicide?
So that's an interesting bit, because if you're looking at attempts, so people who would engage in acts aimed at ending their lives, women tend to attempt twice as much as men. So women attempt more. However, when you're looking at those who die by suicide, men actually die more than women. Estimates are around 4 times more than women. So though women are attempting a bit more, the men actually die by suicide much more.
Do you want to explain that a bit more? Because if you're attempting more, shouldn't you rather?
That is the expectation. However, we have found out that so the modality or there are different modalities people might engage in seeking to end their lives, and women generally would tend more towards the line of overdosing on some medications or some substances. And for that, once you take it in, your body has to process it, and then
Can be saved
before you get
before.
exact.
Yeah.
So someone can easily meet you, chance upon you, you are rushed to the hospital, some interventions are done, and then you don't necessarily die by suicide. However, with men, they tend to be a bit more
Drastic.
heavy-handed. So they're going in for certain acts that are more likely to
Fatal,
really,
yeah.
yes. So you're looking at firearms, you're looking at hanging, you're looking at very missing is quite less likely. So those are some of the things that account for it.
Okay, now we know the things that account for, but what really causes people, what drives people to want to end it all? What could be that bad to make you feel like it's not worth it?
A lot actually, a lot actually, contrary to what we might seem. Um, so it's a myriad of things. Just to simplify it for us, I think we'll classify it as first and foremost mental health disorders, then physical health disorders, as well as impulsive cases. So what I mean is that for mental health disorders, there are a lot of mental health disorders, and these come in with attendant symptoms. So case in point, for example, someone having depression or someone using some substance, alcohol, illicit substances, those two tend to be on the higher side when it comes to suicide. Depression is one has part of its symptoms being, having a lot of low mood, hopelessness, worthlessness, not feeling like life is worth living, coming along with a lot of suicidal ideations as well. And so, and sometimes people might actually be hearing some things, seeing things, and it might all be very negative, kind of pushing you to feel like there's really no hope at all. And in that scenario, it can be extremely intense. That might lead people to actually acting on these emotions, feelings, and thoughts. Substance use disorders as well. Some people might be using certain substances and actually overdose on them. Okay, and these things it's never just clear cut as well. So you might have someone having depression trying to cope using a substance, and then it gets out of house. Someone using a substance and it comes along with a depression. So these things are quite interlaced, and so they are known to lead to suicide rates being up. Then general medical conditions. So you can just imagine someone getting told that they have a very serious condition, or someone is diagnosed with HIV. Now I know it's a bit better than before, but still I have seen a man who came in and had been diagnosed with HIV, and when he was thinking of its
Stigma,
impacts
yeah.
on himself, his family, and amongst other, it really seemed unbearable, and came in with a lot of other attendant conditions as well. Or you can imagine someone losing functionality of all their limbs. Suddenly, you've had an accident. The breadwinner of the family, very high live like you're living your life very active, and all of a sudden you have to be dependent on others. At a point, it might cross your mind that being dead might actually be more of a thing. So it's general cancers amongst others, and sometimes people being in chronic pain. Some general medical conditions come with so much pain, and though you're on pain medications, the control might not be you might not necessarily always go away. So being in that constant pain, such thoughts can easily start coming to mind. So general medical conditions, different types, can also lead to it. Then I mentioned the impulsive side,
Impulsiveness.
and so with those people might not necessarily have a mental health condition, but then something could happen, and that will lead to extreme emotional distress. So, for example, relationship loss. Someone having losing in terms of a relationship, or some huge financial loss, loss in any form, or even experiencing some abuse, violence. All of these things can cause someone in that immediate period when they're having so much emotional distress to act in that light, and then it might lead them to dying by suicide. So it's never just one thing, it can be different things coming to play.
So suicide is a mental health disorder.
Well, it's not a disorder per se, but then although, as we said, because it has other
Yeah, and
aspects, it's not
it's
purely
not necessarily.
a mental health disorder per se,
So
but it's
depending on which aspects it comes from, it could be a mental health
yes,
issue.
but it's of huge mental health concern to us.
So how do you prevent, okay, even before preventing, how do you see or notice that such and such a person is close to committing suicide? Like you have a friend, how do you know what are the signs to look out for when somebody is being suicidal?
That's a good one. And just a little note about the play on language, because we are trying to work at decriminalizing it. You know, you don't and say you've committed something. It kind of gives a connotation of a crime. Yeah, so we usually try to say die by suicide. So we are all trying to learn to and getting people to actually use these terms as well. But then to the question about
How
what's
to
how
know
do you
when
know
somebody is
if
like,
someone close to you is contemplating this? Generally, you would notice some change in a person's behavior. So sometimes they might become a bit more withdrawn, a bit more reclusive. And for some persons, they might actually start making some statements that might be suggestive of them not being around anymore. So some people might, and I had one person actually say that, oh, it just dawned on him that someone said something like, if I'm no longer around, would you miss me? Or if I'm not around, would you come to my funeral? You know, saying stuff like that that might suggest that they might not be around um, in some time to come soon. Also, for some persons, you might notice they might start giving a lot of their things away. So giving their things out to people. So it's like their final remarks, just handing things out there. Sometimes you might notice people getting things that they really don't need, but then so someone is buying ropes and stuff, and you're wondering what they're going to be using it for because there's really no need for it. They already have a drying line, they have everything set. So why acquiring these or buying weedicides, insecticides when there's nothing really there, and sometimes amassing them little by little. Some people actually be hoarding some medication, so they'll go and be buying in bits over and over again, not really taking them. So you'd notice some change in some of such changes in the individual. Then again, I must add, it's not always that you would notice these things because we said there are some types that are just impulsive. So something happens, and then on that spur of moment, the person feels like there's no hope. The person feels really distressed, and then might act. So yes, there are cases where you would want to look out for these things, and you might get some signs. But there are some cases, unfortunately, that you might just not pick up anything. But we are hoping that all these other signs that come out would actually pay attention to them. Quite often we kind of gloss over them, joke around them, think, oh, that's another thing the person is just saying, we laugh around it, but the person actually means what they are saying. So just giving a close ear, listening ear, and asking further questions along those lines.
you need to probe further and be a friend to people. Sometimes you just assume all is well. And when they are hinting these things, you shouldn't just keep quiet and just,
Shrug them off.
shrug it off. But how preventable is this? So, yes, you don't get to see your friend getting to that point, but is there a point where somebody gets to but is able to come out of it because of some factors?
Oh, yes. So actually, some authorities say it's one of the most preventable causes of death because there's a lot that can be done, and it's from different levels of intervention. So right from the societal level, creating a space help people feel safe enough to talk about these things. One, it's being taken away from it being a taboo topic. In our society, it's one of those topics you don't talk about. It's a taboo. You don't even mention it. Even if someone dies by suicide in the family, let's all pretend it didn't happen. We don't talk about it. Mind you, but someone dying by it is actually a risk factor for another person dying by it as well, because now the whole family has to deal with all the repercussions of this thing. It's stressing everybody out. So we have to talk more about it and let people know that experiencing these thoughts, experiencing these feelings, you can actually get help. Okay, and it's okay to talk to me about it. It's okay for us to discuss it when you have such feelings. Help is available. So having that space to even just be able to voice out such things is a good place to start. Then we can talk about, having adequate places for people to reach out for help. So it doesn't necessarily have to even be a mental health institution. For if the ideal is that I would have it such that everybody around can intervene in the immediate period, give some encouraging words, and then link the person up to healthcare. It can be your GP that's in the nearby hospital. The nearest place of getting help is good. As I mentioned earlier, media is also quite, it has its own
Has a
responsibility as
major
well.
role.
So that has to be taken up as well. Then looking at the legislature aspects, definitely those must come in as well. So decriminalizing, I can't leave here without hinting at that as well. But then having these discussions high up as well so that interventions are at play at all levels. But essentially talking about it, making it something we can discuss, having helplines where people can, and networks where people can actually reach out for help. All these are things that can help individuals. Talking about resilience training, helping people develop resilience, such as when you're experiencing difficulty, it's not the end, but then you're able to think through it and then kind of cope better with situations because life will throw things at you. So helping individuals, young ones, all gain resilience because they're young. It's important. They are also an age group that is quite at high risk as well.
Yes, that's why I was just going into that. What age groups are more prevalent? Sometimes you'd even think it would just be the adults because we're talking about the bills, diseases setting in, but you realize that a lot of young people are attempting, suicide, and you wonder what's are there ages people are prone to actually do that?
Well, yeah. So from the statistics, you realize that an age group that's between 15 and 29 has been noticed to have a very high prevalence of suicide in there. And initially, we're having it as a second leading cause of death. Some new studies from the have placed it up, but essentially, it's still high up there as cause of death within that age range. And that doesn't mean all the other age ranges are safe because right through from there you will notice that it's still there. Even in the old age, there's also a major concern as well when people are losing their age mates, disease have set in and all of that. Some people feel like it's time to just go. So there's no safe age per se, but then just at some age ranges, as I've mentioned, you might notice it a bit more in there. And adolescence is not as easy as we would like to think. A lot of things are happening, and in this day and age, too, much more is going on. Exactly with cyberbullying and things going on. You can be your home, but just still experiencing so much um, in in terms of emotions, in terms of things happening to you. So that age range is a very, very, is very, very. I'm trying to find it, but it's one that needs to be looked
A lot of
this
attention.
attention.
We're
Yes.
talking about help being available. Is it expensive to access this help?
It sounds like a trick question. But so
Because somebody would go like, why should I come to the hospital about this? First of all, we need to decriminalize it. So even beyond that, but now, what are you paying for? So I just want you to walk us through that as well.
okay. So, for example, for the aspects where someone has attempted, so for example, someone has taken in an overdose and all that, it's not about drinking palm oil at home. So that one you definitely have to rush to the hospital. No contemplating it. However, for those where someone might voice it out, they've not yet attempted, but they are thinking it, then you might want to reach out for help as well. And the understanding is that a lot of factors could account for it. The person might actually be having some underlying condition that might actually be showing itself as that. And what I said was just a small summary of it, but there's a lot that could be going on at play. So if you're weighing the cost and the benefits, is always going to be in the best person interest of the individual to seek professional help. Okay. So when it comes to cost, that's how I mentioned that getting to your nearest health facility that's accredited. So generally, with that, your national health insurance should be able to help cater for things like consultation, amongst others, to take off the burden of the cost. But then once you get through, once you go there, an initial assessment is done, and there's the understanding that you need further help or further professional specialist care, then the adequate referral might be done. But at least plugging into the health system is important right from the onset. We are in a society that's very spiritual, so I am very aware that most of these will end up in church.
Church, exactly.
Most are trying to cast out the demon of suicidal, feeling suicidal, amongst
spirit
others.
of suicide.
That would usually be the first point of call for people. And no matter what you say, someone's belief is their belief. However, I would just advocate that whilst you do that, still plug in and take care of the physical aspects that we are talking about. You can't pray about it. God will listen to prayer from anywhere. So just get to the health facility. Let that aspect also be done. So I get complete care.
Suicide is preventable. You don't have to, you don't have to bury anybody. Let's be sensitive. Let's look out for people. Let's just care about people. And the hospitals are there. Let's not feel like people will stigmatize us or, let's just seek the help we need. Yes, it's good to pray, like she said, but let's do what we need to do as well. Thank you so much, Doc. Thank you so much for that. Now let's talk about the decriminalization of suicide once more. I know a lot of you didn't even know it was a criminal offense in the first place, but tell us again why this is necessary.
The decriminalization is necessary because having that law in there keeps it as a taboo thing. Because who would want to say, "Oh, I've gone to break the law," or "I want to," break the law? Especially something as sensitive as this. And I've heard people give arguments that, oh, no one has actually ever had to face the rigors of the law because of it, but then there have been such cases that have come up. So it's not like it's never happened. Fortunately, at least now, when it does get to the police, they'll try and get you to a health facility, but that depends on who you meet. But that shouldn't be the case. The standard of care and the protocol should lead towards trying to get the person to get help rather than trying to penalize. The focus should be to get help rather than to penalize. Because mind you, if someone is really in that state and in a condition that is persistent, the person is having these ideations persistently, you arresting them is not going to stop it. They would get, wherever they are, they would still look into interventions of trying to complete or act it out. So getting help should be the focus. And as a people, as a country, that should be our posture. And our law should reflect that posture, that we are trying to help individuals and not try to make them face such things. I know some people have very strong opinions about it, and I think in one session we had one of our parliamentarians in there, and I think for him it was sensitive because he had lost a daughter to suicide, and so you could feel, yes, and his perspective that look, the law is protecting families and everyone else. It's keeping you from doing it, but it's not going to stop anyone from actually doing it. Just that they're going to try and hide now and try to make sure that once they attempt, they don't have to miss it, because if I miss it, I'm going to, so now that's kind of makes it more of an issue. So we should have a second look at this, and we should decriminalize it.
It's very important that we decriminalize suicide. We need to make interventions and not penalize them. We're going for a quick commercial break. Please do send your questions, send suggestions. We'll give you feedback on the helplines to contact Doc on if you also need intervention. Do stay tuned. We'll be right back. Welcome back from the break. If you just joined us, you've missed a very insightful discussion. We've been talking about suicide and why we cannot commit suicide. So, If you're just joining in, please go back and watch and then send your questions, your comments, your suggestions. Like I said before, the help lines are on the screen, they're scrolling down. And so do reach out. We're here to help you. We're here to be the intervention you need. So, Doc, final remarks. Anything you want to say to people about why life is precious and why you cannot just take your life?
I would like to first start off by saying that suicide is real. Most people think it's something for the rich countries, the high income countries. They have the luxury of such things, but that is not the case. The statistics show that low middle income countries have a higher percentage of it occurring with us. Okay, and Ghana is part of this low middle income country. So it is a reality, and it shouldn't be the case. It's not a taboo topic. We should talk about it. And our spaces should be safe enough for people to air out such thoughts because they are real. It happens to anyone. It can come to mind. You can have that feeling. And we should appreciate and understand it when people mention such things and give it the necessary attention. Because for someone to mention it, it means that you're actually on the fortunate side because they could have actually kept quiet about it and just acted. Also, people have actually asked if it isn't just a means of trying to get attention,
Being needy.
especially when someone might have said it kind of time and time and again. That is a possibility, but then I always educate that it's better to err on the side of caution. Sometimes someone might have attempted once, attempted again, and then family thinks this is just a person's way of getting attention. But then we should understand that if someone attempts, it increases the risk of them dying by suicide subsequently. So once someone attempts, it means we have to get a closer eye in there. And the necessary interventions have to be put in place. So there's no real point at which you say this is now just attention seeking. Let's take each one seriously. Err on the side of caution, get all the necessary help in place rather than saying it's just the person's nature, radio pesa, and then you leave it and later have regrets. These are things that are weighty matters that have to be dealt with the importance that they deserve. And finally, I would want to also add on that if you are experiencing any of these thoughts, for any reason you're feeling like is the end of the road, um, there's no light at the end of the tunnel, all hope seems lost. That is how it feels now, but that is not the case. There's always hope ahead. Help is available. Reach out, and we are happy to help.
There's always hope at the end of the tunnel. There's always a brighter day after a gloomy day. Help is always available. It doesn't matter what it seems like. It's not the end. And don't say somebody's just being needy. I mean, imagine you ignored and then the person lost their life. Would you be able to live with it? Would you be able to live with the regret? Let's care for people. Let's be intentional about being in people's lives. And let's love people as we want them to love us. Thank you so much for watching, and do stay tuned next time.